This specific patient, we decided to incorporate a prephase into the team paradigm as she's presenting with a grade 3 AC joint separation and is going to be wearing a sling and be immobilized for the first week of treatment. We really wanted to focus on her fear avoidance and self efficacy. We want to lead her through some motions that are going to maintain her lower extremity strength and endurance that she's built up by being a professional athlete and show her that it's really still safe to move and continue to train and exercise um, while she's immobilized and having some of that pain. So our main focuses for the pre-phase are going to be working on stability, range of motion, some lower extremity strength and conditioning, but also incorporating a lot of postural control and core strength, getting her ready to get back on the snowboard. Our first focus is going to be on modalities and manual therapy. In the pre-phase, we're going to be increasing the stability of the AC joint by applying tape. So after applying the prefix anchors, we're going to, the first strip will be placed directly over the shoulder and really stabilizing the clavicle. So putting a little bit of pressure on that clavicle and decreasing that step deformity that she presented with. The three pieces of tape that are going up her lateral shoulder are going to follow the lines of the anterior, mid, and posterior deltoid. To apply these, we're going to have the patient shrug up her shoulders, give her some proprioceptive feedback, and really increase some muscle activation of the deltoid to offload the joint, decrease her pain, and provide a window for us to start performing some therapeutic exercise. For the rest of the phases, the modalities of manual therapy are only going to be utilized as needed. She has potential for some pec minor tightness from being immobilized, so giving her some pec minor releases as she needed, some trigger point therapy with dry needling. She might develop some after being immobilized, rib mobilizations just in case she develops some stiffness there, and then also giving her tools to be able to perform some of these at home, so showing her how to use a foam roller to really increase her range of motion. And the whole purpose of this is just to augment the exercises that we're taking her through and just giving her some pain relief and some tactile comfort and support. Our next focus is going to be on thoracic and upper extremity range of motion and strength. During the pre-phase, we're going to focus on some passive stretches, showing her things that she can do at home, giving her some relief in the clinic, as well as some small little minor exercises. So we're going to have her start doing scapular traction seated on a TheraBall. It's unstable, so it's going to really challenge her core strength and stability, but we want to make sure that her scapular movement is maintained and preserved, and that she's able to really control that scapular movement and start building up strength to keep her scapulas in place for some more advanced therapeutic exercise. Towards the end of the pre-phase, we're going to have her start doing smaller motions with the affected shoulder. So we're going to have her start performing towel slides on a table. The towel is going to help give her some assisted active range of motion as it's going to slide easier, and then slowly increasing the amount she's able to flex throughout the exercise. So we're just really focusing on some active assisted range of motion here. Progressing into phase 1, we're going to have her start doing the scapular retractions in prone using gravity as resistance, and then the towel slides we're going to progress to having her perform them at the wall. So we're also going to have her perform them while she's sustaining a seated wall squat. This is going to challenge her lower extremities, her isometric control. It's a movement and position she's going to be in quite a bit while she's snowboarding, so we really want to make sure that we're maintaining her lower extremity strength while mobilizing her shoulder. So she's going to do the W as a starting position, then raise her arms up into a Y, applying pressure against the wall, really incorporating those scapular retractions. We're also going to have her perform those standing at the wall. So she's going to be performing slides up against the wall with some lateral reaching, focusing on stretching out her abdominals, really incorporating that core stability as well, and then increasing her range of motion. From there, we're going to add resistance to the wall slides by putting a TheraBand around both hands and having her when she's going straight up. So that's going to really focus on maintaining position by adding resistance outside. So she has to push against the TheraBall, really retract those shoulders and lift up. So at the end of the lift, when she goes into flexion, she's actually going to retract her shoulders even more and lift them off the wall and then go back to the wall and come back down. Additionally, we want to start incorporating wall clocks. So TheraBand still around her wrist with her left arm, she would go out to 9 o'clock, up to 11 o'clock, and then up to 12 o'clock. So that's working on flexion and abduction as well as scapular control. And then additionally, we really wanted to focus on her crossbody adduction, so horizontal adduction, as it's one of the motions that's really hard to regain after an AC joint injury. So to modify the wall clocks, we're going to actually switch the application or the direction of the resistance. So with the therapist on the control on the side, the affected side, applying resistance in, so she has to actually take her left arm to the 3 o'clock position, up to the 1 o'clock position, and then up again to the 12 o'clock. So not only is it going to help increase her horizontal adduction, but it will also strengthen the musculature as well. During phase 2, we're going to have her start performing black burns, as there's a lot of evidence in the research to support black burns for AC joint injuries. These are better known as YT, I's, and W's. She would be performing this on a TheraBall in a prone position, still challenging that core and lower extremity strength and stability. We're really looking for symmetry of movements, increasing her range of motion, and making sure that she's performing this without any compensation. She's lifting and really retracting her shoulders and then getting that full range of motion and movement at her shoulder in these different arm positions. Once she's able to do that, we're going to start incorporating resistance with TheraBands, so making sure that her movement pattern and coordination is correct, her scapulas are properly retracted, and then adding in some strengthening to it, and really just getting her ready to start lifting weights. So we want her to be able to perform seated rows, Arnold presses, and shoulder flexion and contralateral lateral abduction on a TheraBall. The contralateral lateral and shoulder abduction are really focused on dissociating her movement patterns and really kind of getting her to focus on different movements between her left and right upper extremity. So as she's raising her one arm forward and up, she's raising the other arm simultaneously to the side, like laterally. So it's just going to help with her motor control, really getting her into doing these opposing movements, but also it's really going to strengthen her shoulders, and we're going to watch a lot here for compensations with her traps, as that's an easy thing to do, is just raise your shoulders up to get that weights up. Phase 3, we're going to start incorporating multiplanar movements. So we're going to teach her the D1, D2, PNF shoulder pattern, and she's going to start just sitting on a TheraBall, being really working on that core and postural strength and stability, but also going into multiplanar movements. She'll probably get the hang of that very quickly, so we'll progress her to doing those in standing, and then adding resistance bands for strengthening. Once she can do that properly, we're going to get her to doing this first with a free weight. So she'll be doing it in standing. It's going to incorporate more lower extremity strength and coordinated movement patterns, that she's going to have to squat down a little bit when she lowers the free weight and then come back up when she raises it. We're also going to start varying the speed at which she performs this, with a huge focus on her eccentric control. So we'll have her go very slowly up with her affected arm, but also going very slowly down. And this is really just working to conserve her angular momentum, and because we want her to be able to perform a quick transition and to kind of slam on the brakes and reverse the movement as needed. That's kind of what she's going to be doing once she gets back on a snowboard when she's performing a grab. So we want her to be able to have the ability to rotate diagonally and stop when she needs to, when she grabs that snowboard, and then quickly reverse it and able to throw herself into a spin if she's doing an aerial trick. So from there, we're going to have her do it with a barbell. The barbell is a lot heavier, so it's going to require a lot more abdominal strength, a lot more shoulder strength, but it also incorporates a lot more lower extremity movement and strength. So this is going to be working towards a really large global movement pattern, making sure that she can do it safely and effectively, continuing to focus on that eccentric control coming up and going down. Phase 4, we're going to start incorporating some speed and some unpredictability into this exercise. So we're going to have her perform a drop catch row. Basically, she'll be holding a weight, she's going to drop it and then have to catch it and stop very fast and come back up to the starting position. So here's a video for that. So once again, having her doing at various speeds, really with a huge eccentric focus, making sure she can control the movement, perform it safely and efficiently, and that she's incorporating proper movement patterns. Once she's able to do that, we're going to add a thoracic rotation at the end of the motion. So she'll drop the weight, catch it, come up, but instead of stopping, she's going to rotate a little bit with her thoracic spine. Drop the weight, come up, rotate. That's just prepping her to be able to do it, like I said, on a snowboard. So in phase 5, instead of rotating at the end of the drop weight or drop catch row, she's going to go into a jump. So she's going to have to coordinate her movement patterns more. It's incorporating more unpredictability, and it's just a more specific way to work on her eccentric control, and then also her movement patterns, and be able to coordinate that eccentric control and movement, and then jumping. Once she's able to do that, we're going to have her do the same thing, but she's going to incorporate a 180-degree turn when she jumps. So she'll drop the weight, catch it, come up, jump, turn 180 degrees, and do it again. So 2 reps of this is going to be a full 360-degree turn. Phase 6, this is the start of our return to sport protocol. So in this phase, we're just making sure that she's safe and is able to perform the movement properly and effectively, but we're going to add more momentum by getting her to do it on a trampoline, and we're also going to add more resistance by strapping her into her snowboard. So just to start, we're just going to have her to perform the plane movement. So she's going to be on the trampoline, she's going to have to jump first, then perform the same motion of the drop catch row, but instead of a weight, she's going to be grabbing her snowboard. Then we want her to be able to quickly grab it, quickly release it, so she can come back down and land on the tramp. Once she's able to do that, we're going to have her start incorporating the spin. So she's going to have to jump up, spin, and grab the snowboard. Starting with just a 180-degree turn, and then quickly progressing her to a 360-degree turn, or even a greater turn as indicated, just to make sure she's safe, because after this she's going to be on the snowboarding hill, and we want to make sure that she can do this properly with motor control without the risk of re-injuring her shoulder.